ago. It's January 30th, 2010. And we have a patient here who's had problems with her neck and shoulders and head and all kinds of different things. What would you say the main problem was that you complained about? I could check your record and we could check it out, but...
I would wake up every morning with a headache and head sometimes localized behind my eyes and my top part of my face. Other times it would be my lower jaw extending into my neck. I would just wake up in the morning pretty much always in pain when I woke up.
Okay.
So that was the first thing I did.
How many years has that been going on?
Probably about 3.
3 years.
3 years.
Mm-hmm.
3 years.
And you don't have any lower teeth on the back side and the bottom?
No, I do not.
So
that was just unfortunate circumstances over time. Took care of those.
So you have kind of a class 2 malocclusion, which means your jaw is kind of like, smile at me once and it'll show you your teeth disappear when you bite. Oh, but right now you have a...
I have my wonderful splint right now.
Well, which one? This is the daytime splint.
This is the daytime splint
Okay.
that I need because I work as a nurse and I need to be able to speak well enough to be able to care for my patients.
So this will be your first experience with this after we deliver this today.
Yep.
All right. Well, tell me what happened when you first wore the other splint, which fits in your palate.
Well, my first morning, I woke up feeling like my jaw was totally displaced. So it was very disconcerting the first morning, feeling like, oh my, it's not normal. I wanted to go back to the way it was. So I just moved on with my day from there. In successive mornings after that, I noticed it get less and less. So I assumed that meant that I was just getting used to having my jaw being in a different place.
But what about the pain?
No headache.
You didn't wake up with that?
I didn't wake up with a headache.
That you previously described.
Yep. I never have had another headache. In 2 weeks now, I have not had another headache like I've had before.
The one over the top of your head and eyes.
Right, and my jaw. Yep, nope, I haven't had a headache.
Okay.
The other thing, coming to see Dr. Neiman, noticing that, I was experiencing pain down into my shoulders and arms, and that's been greatly reduced. It's not gone, but it's not, I don't say, oh, that's really bothering me like I was before. I was always feeling like I was trying to work something out, but I haven't had that. So that, in 2 weeks, that's been an incredible improvement as well.
Okay.
I'm also kind of interesting. I'm finding myself wanting to go to bed earlier, and that's very unusual for me. I've always been the person that keeps pushing the limit at night, 11, 11:30, 12. I get up at 5. But I've noticed, just in talking today, that in a sense, and even in the last 2 weeks, my sleep pattern's changing. I don't know whether I'm finding it to sleep to be restorative and increasing my sense of well-being, which I think it is doing that I'm finding that my body's wanting to sleep because it knows it's going to feel better when it gets up in the morning. I'm able to focus better at work. I'm not as dragged down as I was from day to day. So, I mean, I'd say that in 2 weeks I've experienced quite a turnaround in some of my basic patterns of my life. That's kind of shocking to me right now, even saying it. I certainly didn't think that I was going to say this or be in this place, but it has been extremely life-changing for me.
And how old are you now?
60.
Oh my gosh. Well,
I am 60.
But you were always aware of the fact that your teeth didn't show either on the bottom, because when you bit down, they disappeared.
Right. But I never had much of a bottom lip, or much of anything going on right here. And now I'm aware that when I have the bite split in, that I have more of a definition in my face, in my lower jaw, and my mouth. So it's
you're not closed up like an accordion.
Yeah. I'm not losing it by having my top teeth over, totally closing off, covering over my bottom teeth. So, it's like losing half of your jaw when you do that.
Yeah.
So that's been nice. It's just, realizing that I have more of a presence in the bottom of my face. It's
Okay,
very
well,
nice.
that might be interesting in doing another film here, and maybe 4 or 5 weeks later after you start wearing a daytime squint.
Then you're going to tell me I look 5 years younger already. That's what I think.
That would be nice, wouldn't it?
Yes.
Well, thank you very much.